Welcome to Horizons Radio, a broadcast of the Battle Creek Community Foundation, heard every Monday at 5 p.m. on WFPM 99.5 in Battle Creek, 99.9 in Albion, and 103.7 in Jackson, Michigan. You may also tune in through the internet, in your car, or while at work. However you are joining us, thank you for being with us today. My name is Lynn Ward-Gray, Development Officer for the Battle Creek Community Foundation and your host for Horizons Radio. At the Battle Creek Community Foundation, we envision a vibrant, healthy, and viable Battle Creek and partner with individuals, families, and organizations to make this vision a reality. We help donors explore their philanthropic passion and connect that passion to nonprofit organizations that are making a real difference in our community. I am joined by a great friend of the Battle Creek Community Foundation who is doing some great work that literally saves lives. Sadly, we've heard it many times in the news about women who are being abused, and my guest today will be talking about, this very touchy subject that is all too real for many women, many men, and for many families. And unless you are armed with the information, your ability to make informed decisions and choices may be diminished. It's really all about prevention. So, today, have I given you a big enough teaser? Today, my guest, and actually, I have a few great friends. I have 3 great friends of the Battle Creek Community Foundation, and because they are connected to us in so very many ways. We are so happy to have them. My guests are Joyce Siegel from Sexual Assault Services, and or I can say SAS, or we might be saying that long name the whole time. So SAS Program Manager. Hello, how are you, Joyce?
I'm doing well. Thank you, Lynn.
Great. Now, Danielle, I'm going to kill your last name. How do you say your last name?
You say it Kostrab.
Kostrab. Okay, we have Danielle Kostrab. She is the Child Advocacy Center, or CAC coordinator at Sexual Assault Services. Hello, Danielle.
Hi, Lynn.
And we have Phyllis Van Order. She is the SANE program coordinator for Sexual Assault Services. And in case you're wondering what SANE stands for, that stands for, Danielle, yes. Phyllis, why don't you tell us?
Sexual Assault Nurse Examiner.
Exactly. I was going to say that because I looked it up in your information. But it's so much better when you say it, of course. Welcome, Joyce, Danielle, and Phyllis. Welcome all to Horizons Radio.
Thank you.
Thanks for having us.
As always, I ask my guests to tell me about their journey to their current positions. And yes, they do it in 2 minutes or less every single time. So people want to know, kind of what the expertise in the room is and who's speaking, kind of where they came from. And it also just lets them know that, hey, there's a lot of talented folks that live here in the city of Battle Creek and surrounding areas. So let's start with Phyllis, then Danielle, then finally Joyce. So Phyllis, why don't you give us a little bit of information about your journey, the one that has led to your current position as the SANE Program Coordinator at SAS?
Sure. Thank you, Lynn. Again, my name is Phyllis Van Order. I'm a registered nurse. My background in nursing was emergency and trauma care, and that was where I experienced interfacing or caring for patients who had been sexually assaulted about 17 years ago. And I felt like the patients, we weren't really able to meet their needs as well as I had hoped in the emergency department setting. So I had an opportunity to meet with other people from our community. The Battle Creek Community Foundation was a big impetus for that project, bringing people together. Mm-hmm. Met with some other folks in our community that really wanted to have a more coordinated approach that included a very comprehensive, high-quality medical access point for victims of sexual assault. And that I had been interested in that because, again, I saw firsthand that we didn't always meet the needs as best we could. I think we did the best job in that setting as we could, but it just wasn't optimal. So knowing other people, meeting other people from the community, and that interest that I already had kind of propelled me into this, and it was a wonderful opportunity. I've learned so much. When I went to nursing school, I never dreamed I would do this kind of work. And it's been an incredible journey over these last many years, and I'm proud of what we've done in the community. The nurses that I've worked with, the social workers, the community leaders, community members have been amazing, and I think we do have a process by which patients or victims of sexual assault, when they choose to seek help, get the kind of help they deserve that actually promotes health and healing for them.
Well, thank you. Thank you so much for the job that you're doing here in our community.
Thank you.
Yeah. Danielle.
Well, I'm a clinical social worker, and my interest, I guess, in sexual assault and child sexual abuse started way back in high school. I had a really strong interest in social justice and advocacy work. In fact, I was giving speeches in my high school speech class about sexual assault, dating violence, domestic violence, and child abuse, and that kind of stuck with me.
So you came by this honest.
Yes. And then I went on for my undergrad work to focus on getting a bachelor's in social work and did an internship with a wonderful agency that worked with domestic violence and child abuse as well. That carried with me to Western Michigan University, where I got my master's of social work degree. And during that time, I was fortunate enough to have an internship actually with sexual assault services. And once I was there, I never wanted to leave. Yep. And I've been there 16 years. And
16 years?
Yes.
Wow.
And the passion continues today to just really advocate for all survivors. And it really, for me, my focus has been on work with child victims and families and believing that they need us to raise our voice. And so I've stuck with it.
Thank you so much. I'm so inspired by everyone. Joyce.
Well,
you've been at this for a while, so do tell.
Yes, I came to Sexual Assault Services in 1997, and it was after doing an internship for my social work degree, my master's of social work at Western Michigan University. I interned at Safe Place, our sister agency in the community, and I learned about the new and developing organization, Sexual Assault Services, and I came to that from my work in Battle Creek at Safe Place, but really what was my inspiration was in my education as a social worker. I realized I wanted to do work that would assist women and children, and I knew that sexual assault survivors and victims of child sexual abuse were the avenue for me to do that, which I felt called to do.
Well, what I'm hearing through everyone's, journey is that you saw it firsthand in some way. You experienced this either through your education or through working directly with victims. And so having a heart for this work just really makes a difference, I'm sure, in these victims' lives. So thank you all for what you do. So next up, I'd like to thank you for once again joining me, being our April Horizons radio show, which we thought was really timely because April is Sexual Assault Awareness Month. So let the awareness begin. Joyce, why don't you tell us about Sexual Assault Services of Calhoun County? And I know we give the contact information typically at the end, but in case someone is in need or knows someone who needs some help or assistance, can't listen throughout the entire show, let's give that information to our listeners now, as well as kind of as each individual kind of speaks, each new speaker comes on, just to make sure we're getting, the contact information out there. So, Joyce.
Okay, I appreciate that because it is very important that people be able to reach us. We do have a 24-hour toll-free crisis line, and it is 888-383-2192. We also, our business line is 269-245-3925, and that you can reach us Monday through Friday there.
Wonderful.
So my part in this is just to broadly talk about sexual assault services and what we do. And we are a program that does comprehensive services for victims of sexual assault, and that would be for any age victim, for children, for adolescents, for teens, for adults, and for the elderly. We have served sexual assault victims of all ages, and we also provide services to their loved ones, So this does not just affect the person who was sexually abused or sexually assaulted. This act of sexual violence will affect everyone in their family. It will often affect their friends and other loved ones. And so our services are for them also. All of our services are free of charge. So Danielle and Phyllis are going to speak more specifically about those programs to serve children and to do the crisis medical and advocacy piece for our victims 24/7. But the other services we have are counseling, and we have a very fine staff of master's level therapists who are trained in trauma-informed methods to assist trauma victims, and sexual assault victims are victims of trauma. And so the counseling is free. We do individual, group, and family counseling, and we're very proud of our program and how well and how much we can help people. One of our therapists has a facility dog, a service dog, and so we also have some extended services to help victims with the support that maybe might help them with an animal-assisted program. We
just a variety of things.
And we use holistic
really
approaches.
Meets the needs.
Yeah, we use holistic approaches too. Our therapists use art and music and movement in various ways to assist survivors, because they don't just respond to sitting in a chair and talking. So we do lots of different things in our therapy program, and it's really trauma informed.
Well, I mean, I think it's wonderful that you're able to offer this free of charge. So I wanted to make sure we lifted up the folks that make that possible.
Yes.
So who are you connected to, and how does all that work?
Well, one of the really important partnerships we have is with Bronson Battle Creek and Bronson Healthcare Group, and we are a department of Bronson Battle Creek. And prior to that, it was Battle Creek Health System. They took us, and they provide all of our space, and it's in kind to us. And then all of the services, support services, administrative things that the hospital system would provide, like payroll and administration and all those things that we don't, as a nonprofit, have to worry about, because our larger organization takes care of that for us. Well, that being said, we're grant funded. So all the salaries and operating expenses are from grants, and we have many grants. We have the federal, state, and local grants. You can see all of the list of our funders on our website. Our annual report is on there, and those are all listed and in our brochure and all of our materials. But some of the big ones, the local foundations started us out. Battle Creek Community Foundation.
There we are again.
Yes.
As everyone knows, there's always a connection as to how our guests are selected, and of course, they have a connection to the Battle Creek Community Foundation in some way. And so, as I said, they've been a long time friend of the Battle Creek Community Foundation. We are so thankful for the work that they do in the community, and this is just great to have you on, especially during this month, talking about all of this and really giving people an outline and awareness of things they might not know are going on in the community. And I think, certainly we were going to talk about, let's talk about it now. What is the need? Why does sexual assault services exist? I was looking through your annual report and, just amazed at how much, some of the statistics. So, Joyce, talk a little bit about that.
Well, nationally, we hear the need. The statistics are, vary, and you hear 1 in 3 women, 1 in 4, 1 in 10, and we don't know for sure, because survivors don't often report. We know that only 1 in 10 or 25%. The statistics are so variable, but we know it's a vastly underreported crime. And we also know that we serve in our community about 850 to 900 people every year, and for the various services.
Well, let's talk about that just for a quick second. Does anyone, and anybody can chime in at this time from their vantage point, what are some of the ways to get people past that fear and to report? What are some of the things that you all talk about amongst yourselves to try and get them, to actually move towards reporting. And I get it. There's not everyone can do that because of their safety, the safety issues at times. But just wanted to throw that out there.
I think awareness, this is Phyllis Van Order, I think awareness is one of our biggest challenges. And we do have a full-time person on our staff that does community prevention and awareness activities for us. But even though, this is a wonderful service, and when people need us, they're very grateful. I feel like they get very high-quality care from us. It's still a pretty ugly topic in a community. Who wants to believe you live in a community where 900 people need sexual assault services? So we have presentations, we go out and talk to groups, and everyone is amazed at what we do. They take our information, but I think it kind of gets filed away as this will never happen to me, I'll never need this. It's nice that this is here for other people, but it's not anything that I might need. But then something happens and they need it for themselves or someone else. And then how do you have that number? How do you have that information at your fingertips? So that, I think the awareness of the fact that help is available is a challenge for us, even though we work very hard about that. I think that the decision to report is a very personal one.
Absolutely.
For individuals, and trying to tailor a service that can respond to all those nuances has been challenging. And I think we've done a really good job of that, those people who are apprehensive about engaging the law enforcement community, or what's this going to mean to their family system, and those kinds of things. I think we've done a good job of addressing those barriers, but there are numerous ones that are very challenging, I will admit.
Awesome. Well, thank you for sharing. I think that's good to hear. It's not one cookie cutter, this is why people don't report. It can be so nuanced, and certainly you have a lot of community partners for who they might engage with, like you mentioned, law enforcement and things like that. They can kind of help guide them to the services. So that's really, really good information to get out there. Danielle, you have a heart for kids.
Yes,
for the children. So talk about the Child Advocacy Center and the services, the facility, and what you guys provide.
All right, Lynn. Well, I'm going to refer to the Child Advocacy Center as the CAC, which is a program of SAS. And the CAC is a child-focused center that provides a coordinated, collaborative response to addressing child sexual abuse and also severe physical abuse in our community. The CAC is emphasizing the coordination of investigation and intervention services by bringing together professionals and agencies as a multidisciplinary team to create a child-focused approach to these cases. So what we really are working at is looking at what does this child and this family need from this group of individuals who are invested in helping to keep children safe and create a safe community, and also to help them have healing and hope and to really thrive in their lives. The CAC provides a safe and child-friendly environment for the children and families when they come to see us. We provide coordinated investigative team interviews by a trained forensic interviewer. We have victim advocacy and support for the parents and caregivers while their child's being interviewed and throughout the investigation and treatment process. We help them access referrals with our SANE and with our child abuse pediatrician for specialized forensic medical evaluations. We connect them to referrals for trauma-focused therapy for children and non-offending caregivers, and sometimes they get to meet the therapist that day that they might be seeing at sexual assault services. We also provide court advocacy and follow-up contact with families, and every month we have a case review team meeting where all the different professionals come together to look at these cases and process what's working well, what did we miss, what still does this family need from us, and how can we help them get what they need. We, as Phyllis mentioned, we have our community educator who does prevention work, and we also provide community education and trainings for our MDT members. And so when I keep talking about MDT members, I'm going to go into what does that mean? What is our multidisciplinary team? Our multidisciplinary team includes a family advocate, a forensic interviewer, it includes the CAC coordinator, it includes SAS therapists, it includes our sexual assault nurse examiners, it includes the child abuse pediatrician, it includes law enforcement, child protective services, prosecutors, community mental health, and we also have a juvenile probation officer who comes to our case review meetings.
I mean, this is real wraparound service, as they say.
Absolutely, and that's
Wow.
our goal, is for all of us to come together and coordinate this response so there's a sharing of information so that this child doesn't have to be interviewed multiple times, so everyone can come together and best serve them at one place that's neutral and it's welcoming to children and families. In fact, we have 2 sites. We have a site here in Battle Creek, and we also have a donated satellite site at Crossroads Church and Ministries in Marshall as well.
Okay.
Yes.
Okay. And what are some of the, are there any tips or things based on what you've seen over your 16 years in this field that you could point out to any of our listeners that you see when working with children that would be helpful for them to know?
I think it's really important that if a child discloses something to you that has to do with any type of sexual abuse or other child abuse, to make sure that you get that reported to law enforcement or child protective services, or to talk to your doctor, their mandated reporters, or if you belong to a church and your pastor, to really get the help you need and to believe that child and to access those services. That's really, really critical. And sometimes it's really hard because a child might tell someone else before they tell their parent, and that can be hard for a parent to think, how come they couldn't tell me?
Right.
And I always let the parent know that the most important thing is that they did tell, and that's what we want to focus on, that kids are worried about telling their parents. It's an incredibly difficult thing to have to tell someone about being sexually abused, and it takes tremendous courage when a child does come forward and tells about that, and we need to honor their strength in that.
And talk about, just if you could quickly, the timeline. What difference does it make if a child tells 1 week from the time it happened, or 1 day from the time it happened, or 1 month, or just different time frames? How does that play out as far as services and how you help that child?
Well, and I'm going to when Phyllis talks, she'll talk about if it's a recent disclosure, what type of services are put in place in terms of the medical evaluation and advocacy for that child and family. But what we know about disclosure of child sexual abuse is that oftentimes kids don't tell right away, if ever. That oftentimes it's after long delays, and there's a long period of time after it's happened. And it's not typically just one incident that's happened. And so whenever that child tells in their time, that they're going to have this response from these dedicated individuals who want to help them, regardless of when, to help them heal and thrive.
Beautiful, beautiful. I'm going to get to Phyllis, but there's so much to talk about because there's some statistics, some myths, just so much to talk about. So if we can loop back to that information, we'll certainly do that. But Phyllis, I mean, I know you're looking at it from the nursing standpoint. So kind of talk about the importance of forensic care after sexual assault.
Sure. Again, if you're in immediate need for services, please call our 24-hour crisis line, which is 888-383-2192. That's staffed 24 hours a day by counselors that will answer the phones and will contact our nurse examiner if necessary. We have I call our crisis response team that's on call 24 hours a day, 7 days a week, which is composed of a nurse examiner, which is a registered nurse with advanced training and education in the comprehensive care of patients who've been sexually assaulted or abused. And we also have a victim advocate. It's either a staff person from the SAS staff or a trained volunteer from our community, and they have extensive training. And I think we have about 35 volunteers right now in the community that are on call 24/7 with our nurse examiner. So if we have someone who's in need of services, then we can help them.
And talk a little bit about. If I'm thinking of this question, maybe somebody else is thinking of this question regarding abuse, physical, mental abuse. Is there a distinction or a way that individuals who, I'm thinking that individuals who have had a certain type of abuse might just brush it off as, oh, that's just how it is. Can you kind of speak to, really naming it and identifying abuse?
Absolutely. I think that's when I think back to my answer about what are the barriers, I think that's probably the biggest one is we don't have a societal agreed upon definition of what sexual assault or sexual abuse is.
Okay.
So many times we have people who may call us and say, I'm not sure if what happened to me is really sexual assault, rape, molestation, abuse. And what I tell people is if you're unsure, call us. We have trained people that will answer your questions, will talk with you. We don't want to put, or at least I don't want to put victim labels on anyone. But if someone has concerns about what's happening to themselves or what's happening to someone they care about, then I would encourage them to call, talk with our nurse or our counselor that answers the phone, and talk through what's going on with them, because we're going to get them the help that they need if they'll just reach out and make that call.
Excellent. And talk about some of the prevention information that you give out and try and get people to understand.
Well, we have, like I said, we have a person on our staff that does that. And my work is definitely on the back end of prevention, because when people are coming to me for services, that means something's already happened to them.
That's true.
And so what I'm kind of focusing on as far as prevention for them is maintaining or helping to promote health and healing. And so I'm kind of working from that point. From
a like evidence collection and preservation.
Absolutely,
kind of
that is.
What does that look like?
That's a component of the exam. If we have a patient that is a candidate for our services, that's someone that's been sexually assaulted or sexually abused within the previous 5 days or 120 hours. And we can extend that time frame out in certain circumstances, but I would urge listeners not to take that time frame as an absolute. If you have a question, call and talk with the nurse. We want to talk to people individually, but in general, we can do that medical forensic exam up to 5 days after it's happened, which is kind of surprising to some people, because particularly the CSI, the people who are watching those CSI forensic file shows are thinking about DNA and thinking about our exam and interventions in the context of that evidence collection piece. And what we do that is one of the things that we do, but what we do is much more comprehensive than that. Every person who's making that call is in a crisis because something awful has happened to them or someone they love. So we do a lot of crisis intervention. Safety planning is a huge issue for our patients, because most of the patients we see are assaulted or abused by someone they know. And many times that person still has access to them in some way, shape, or form. So safety planning is a huge piece of what we do. And then some people are concerned about their medical needs or their healthcare needs. Did what happened to me make me at risk for developing a sexually transmitted disease? Did it make me at risk of developing a pregnancy that I may not be prepared for? And what are my options around all of those things? And so all of those things are addressed and really are about 90% of what we do. And some people do want to engage the criminal justice process, so that evidence collection piece is a very important piece for them. It's offered to every one of our patients, and it's an option, just like everything that we do is an option. Our patients consent and agree to the exam, and then we can help facilitate what is best for them in their healing.
Wow. I mean, as always, we always run out of time. And I did want to get two critical pieces of information before we go. Certainly, I imagine you all have volunteers that work with you all. So if anyone wants to volunteer, there's I imagine a myriad of different ways they can contribute. Who would they contact, and what number would they call?
They can call our business line at 269-245-3925, and they can also access on our website, www.sascc.net. They can access a volunteer link for the application for our training.
Wonderful. And I just wanted to thank Joyce, Phyllis, Danielle for being with us today, and thank you listeners for joining us. Hey, we'll have to do Sexual Assault Services SAS Part 2, I think. Anyway, thank you all for being with us, and thank you listeners. The Battle Creek Community Foundation, established in 1974, receives its funds from Battle Creek area citizens and businesses that are committed to making Battle Creek a better place to live. For more information about what we do, 269-962-2181 or www.bccfoundation.org. Thanks so much for listening.
Helping to grow each generation. Battle Creek Community Foundation. Give to your community. We'll help you build a legacy. Start a scholarship. Be a volunteer. All your ideas are welcome here.